Hi, I'm Stephen Kraft, the Operations Manager of the Simulation Center. Welcome to the Simulation and Skill Center's ICU. In this video, we will discuss how your course facilitators and the Sim Center staff have created an experience to allow you to immerse yourself in a simulation scenario representative of true patient care. Learning in a simulated environment allows you to safely learn through uncertainty and mistakes. Careful attention has been given to the simulation environment and details in the scenario to allow you to engage with the mannequin and maximize your learning and knowledge retention. Despite our attempts to create a realistic environment, not all aspects of the simulation may be totally realistic. We ask that you do your best to overlook unrealistic aspects of the simulation and immerse yourself in the experience for the sake of learning. In a few moments, we will review what can and cannot be simulated during your experience and provide guidance about how to work with the lapses in realism. Prior to your simulation experience, your course faculty may share additional information with you, such as learning objectives of the simulation, preparation work that supports your learning and simulation experience, elements about the simulation environment not covered in this video that will be critical for your simulation experience, expectations for your role or roles, a description of the instructor's roles, and boundaries of confidentiality and privacy.
Hi, I'm Robin Moralia. I'm the Simulation Skills and Education Specialist in the Sim Center. In this portion of the video, we're going to talk about resources that are available in the ICU for you as the learner to move towards meeting your learning objectives. And we'll start with the capabilities and limitations of our mannequin. This mannequin can open and close its eyes. It has chest rise and fall that mimics breathing and has lung sounds that can be auscultated using a stethoscope. It has palpable pulses in all the places you would normally feel a pulse, and it has a working IV. It can make coughing, crying, and screaming noises, and can demonstrate seizure-like activity. The mannequin can also talk to you in response to any questions you may ask it to provide you additional information. The mannequin can be defibrillated, cardioverted, or paced using the life pack, which we'll review in a subsequent video. In addition, the operating software can provide us with valuable information. It can tell us about the rate and depth of chest compressions when you're doing CPR, and you may be provided information about the quality of your chest compressions. It can also display tube placement if you've intubated the patient, and you will also be provided information about tube placement post-intubation. As great as he does have some limitations. The mannequin cannot move in response to your commands. Skin temperature and color cannot change, and swelling and edema cannot be reliably simulated. In addition, a facial droop cannot be simulated. The functions of the mannequin in your simulation will be determined by your learning objectives and the progress of your simulation scenario. It will be important for you to engage with the mannequin just as you would a patient. So talk to the patient to gather more information and complete your assessment. Use chest rise and fall and lung sounds to determine respiratory status. And make sure you palpate your pulses, being sure not to press too hard or you may occlude your pulse and not feel a pulse when there actually is one. And a tip, the femoral pulse is the best place to feel a pulse on this mannequin. If you need information or assessment data from the mannequin that is one of its limitations, like we've already described, please verbally state that you're looking for that information, that you're assessing for his response to commands, skin color, etc., and the information will be provided to you. We're going to now discuss a few other resources that are available to you in this space. Throughout your simulation, your course faculty and the Sim Center staff will communicate with you in a variety of ways to guide your efforts and provide you additional information. We have the patient voice, the telephone, and standardized healthcare providers. So first, with the patient, make sure that you're talking to the patient, asking patients questions as you normally would in the clinical environment, and they will provide you more information if that is in accordance with your learning objectives and, again, your simulation scenario. Simulated healthcare providers. Sometimes there are additional staff in your simulation that are taking the role of other healthcare providers, like a charge nurse, a respiratory therapist. If they are in your scenario, their role will be disclosed to you and they will be considered a source of truth. Additionally, we have a telephone. This is a working telephone, but in the event you need to call outside of the simulation for additional assistance moving through your simulation scenario, you can pick up the phone and dial 75114. Please do not dial 21212. Dial 75114. Someone will answer the phone and you can ask for additional resources and additional guidance will be provided to you. We also have a gray resource cart for you in this room. This cart contains a variety of supplies that you may need for your simulation scenario. It's organized differently than the clinical setting, but there are notations on the drawer of what's in them. As a reminder, supplies in the simulation center are reused, and you would never reuse or use supplies that are opened, unsterile, or broken in a clinical environment. Okay, we're going to move over here and talk a little bit about the code cart and the patient monitor. So in this simulation environment, we do have an older model bed, but it does have a CPR release function. So in the event you have something critical with your patient and you need to lower them quickly, you can use the CPR release function. When you go back to your clinical setting, you should take a moment to familiarize yourself with the beds that are in your clinical environment and make sure you know how to use the CPR release function. We have patient bedside monitor here. The monitor will display patient vital signs and potentially additional information that you need to move through your simulation scenario. The screen is interactive and touch activated. Initially, the vital signs that are displayed will be determined by the learning objectives in your simulation scenario. You can touch the screen at any point to get additional information, especially you can hit start and stop to repeat your blood pressure. And finally, we have our code cart. This is a simulated code cart similar to what you would find in your clinical practice setting. It also contains a defibrillator. If your scenario requires the use of a defibrillator, please remember that this is a live defibrillator, and in order to use it, you want to do so safely, making sure that if you're going to deliver energy and push shock, that you do what you would do in a clinical environment and make sure everyone is all clear from the patient, the bed, and any equipment touching the bed before you push shock or you will harm someone. I believe that's all I have to discuss about what we have in the clinical and simulated clinical environment. Your faculty may review additional supplies, equipment, or information that you may need to facilitate movement through your simulation scenario and meeting your learning objectives. Thank you.